yay. Okay, so the internet is better now. Hello, everybody. We are live again. I'm sitting outside. I got tired of sitting inside. Hello, Queen. Hello, Dr. Ken. I am going to invite you to join me on the live. Ken will be joining us. Our executive director, Andrea Brown, will be joining us as well.
Hi.
Hello.
How's it going? See if I
it's going. I can hear you. You look great.
Awesome.
Thank you so much for sharing your flyer. Everyone's done such a great job in promoting what we're doing today, and we really appreciate you guys doing that.
No problem. It's an exciting topic, so what better way than to end Mental Health Awareness Month?
Yes. And so I would be remiss. My family has gotten on me. They're like, we've been on all day. Have you gotten any donations? I don't know, but I will say this. Please help us. The Feenster family wants you to know that they want you to donate to Black Mental Health Alliance and help support our work. Because really, just like Andrea, we're like, at this point, just like Dr. Ken, we're volunteering our time to make sure we're discussing these topics and really put priority, just like Richard was on. We have a training this weekend that Andrea has graciously, for Mental Health Awareness Month, made free to everyone, even people that aren't providers, mental health providers like myself. So to help support the work and keep the work going, please donate to Black Mental Health Alliance. Become a member. All of our gurus that have been on, even Dr. Ken, we're not paying them to be on. They are really, they believe in the mission that we're doing here to really get the Black community to optimal mental health. So how do we donate? Oh my God, thank you so much. Highly praiseworthy. Link in our bio. We have a couple of links. So if you want to sign up for the training, you could click the training. If you want to donate to us, you can click that drop-down link also in our bio. And we also have how to become a member. Lynn Johnson and Cheryl Maxwell, if you're a provider, Cheryl Maxwell will follow up with you. If you're just a lay person who's really passionate about Black communities getting healed, you can reach out, and Lynn Johnson or I will follow up with you as well. So that was just our spiel from the Feenster family, and also that all of the Black Mental Health Alliance employees are also members because we believe in the work that we're doing. So with that, I'm gonna pass it over to our fearless leader, Andrea Brown, who also has no problem asking people to donate and support the work that we're doing here at BMHA. Yeah, we can hear you now.
Oh, thank you so much, Roxana. And I'm so glad you are outside. I know. I just want to say for the record, and I believe in giving flowers in a real way. I order flowers and some more stuff. But Roxana put this entire day together. And I know I had no idea what I signed up for. But it has been awesome to be able to have these conversations. But more importantly, Roxana, thank you for I don't even know if she took a bathroom break. She said she did. I don't know. Because I'm like, since 10 o'clock, she been rolling. And I have had 2 outside meetings. And I'm like, is she still talking? So I have not forgotten you, Roxana. And so I appreciate you, and I really am thankful. And so we have Roxana had this brilliant idea, and I really do mean it was a brilliant idea, to, on the last day of Mental Health Awareness Month, to really do an IG takeover. And we have the most brilliant and brightest minds that are with us. And so from this morning, we had, I've been calling Roxana an urban gardener, but we really did have an urban gardener with us who talked about his mental health challenges, his wife, who is a registered nurse, but specifically for psych, and just how he has learned to reimagine his life and himself, right? And so it has been a tremendous day. I have pages and pages of notes, and not for any particular person, mainly for me, because we have talked about how to care for your loved ones while Black, right? That what that looks like. And I know people say, "Oh, that's so silly." No, that's so serious. And how not to be selfless, but be self-full. Um, we just heard from a brother who is taking care of his father, and I'm just blown away, right? Because I think about um, being a caretaker for my mom, and just I wish we had the opportunity to take care of my dad, but he's been gone now 14 years, but just powerful, and what that looks like, right? And how we in the Black community are impacted differently, and how the numbers will suggest that we don't do that at all, but yet we do. So so it's really, really been a powerful, powerful day. And so I am excited about this prime time sister um, on with us, and she does not mind, but I think she earned it. And so Dr. Kenyatta is with us today. I'm going to ask her to tell you a little bit about who she is, where she hails from, and then I think we're going to really get into this because she is passionate about health and wellness for Black people, mental health and wellness. And I think you will learn some things
Yep.
about long COVID, right? That we don't know. And what's really interesting is I want us to be armed with the information. So as we start looking at our mental health and wellness, we're like,
Yep.
that's what that's the ticket. And, even for all of you folk, and no shade, no judgment, we love you, who said COVID wasn't real. Well, I will say the best man at our wedding, who I have not met a more noble man, died from COVID, and that was early on. And so if we think about the numbers, and again, you don't need me to introduce her because that's how bad she is. That's how bad she is, and she is, while she's not my Greek sister, but she is Greek. She is a dear friend of some folk that we work with. And she's a member of the first sorority, Alpha Kappa Alpha, and we won't take anything from her or from that because we, we Greek, and so we share that. And so, Dr. Kenyatta, thank you for being here with us. Thank you for being with us at 8 o'clock. And thank you. I know you
Yep.
are, I believe, in Atlanta right now. But just to know that folk have been waiting for you, and for all of those naysayers about long COVID, or who don't believe it, I can't wait for you to set the record straight. But also, just so you know that this will live on our YouTube channel. And so, we will drop snippets throughout, right? Because we think this is important. So thank you for joining us. Talk to us a little bit about yourself. And let me just tell you,
Thank
those
you.
glasses are
I
fly,
was
girl.
like, what can I do with this little snapback? I was like, I gotta go hard with the glasses. So had to like dust these off. I've been wearing them. Like I will say this pair gets like the most attention and compliments. So thank you.
They are fabulous. They are absolutely fabulous, even with your
Thank
snapback,
you.
honey. Do your thing.
So, hey everybody, I'm Dr. Kenyatta Stevens. I'm an infectious disease epidemiologist. Um, I am, let's see, also adjunct professor of public health. I teach at the graduate level. And so I've been teaching for 7 years. And what else? I am a public health practitioner. I am a community health advocate. I'm a public health advocate. And I don't know. I think this is like my first live. Like, most of the people, my followers that are on here, know that I was like doing lives 2 and 3 times a week during the pandemic. And so I actually had someone in my DMs like, I miss you live. Like, when you're going live? And I'm like, it's coming. Just hold on. And so I'm here. What can I say? I have 13 years experience working at CDC. I also have a background in molecular genetics and molecular biology. Prior to my public health career, I was a scientist, a research scientist at Emory University. So I did breast and cervical cancer research. And so that experience kind of carried over into that public health experience, just working with women's health and teen health. So that's kind of like my background. Did I leave anything out? Are we ready to get started? Is everybody ready?
You're kind of a big deal, basically, is what you're telling me.
You're kind of I was about to say, she's a bad sister, right? She's a bad sister.
It's not a big deal, you know. Research, blah, blah, blah.
She said, and I studied molecular. And I'm like, is that with 2 L's or 1, right? Molecular. Yes. I'm a research scientist. And basically what she was saying is, I'm a bad chick.
Yes.
But we appreciate and acknowledge your brilliance, right? Because there's some young girl looking now, or her mother's gonna tell her they saw you on IG, and so there's some young woman that will follow in your footsteps.
I just want you to know that's in the chat too. Little Ray said, and she is. Fern said, absolutely. High praise worthy 100 said, yes, sis.
That's right. That's right. So let me just tell you something. None of us here are hating. We are acknowledging and celebrating you and your brilliance. There is Black brilliance, and it is, you remind us, you and others remind us that it is unnatural for us to fail. Unnatural. But just wait for my TED talk on that one. But this is all about you today. So let's talk about, thank you for the bio about your work. I love that before then you were a research scientist, right? I'd love for you to talk about, the impact of COVID on communities of color. And then if we could, Roxana will monitor the chat. I think we should talk about, this whole notion of long COVID, because there are skeptics like, yeah, right. So talk to us about what that is and how do we protect ourselves?
Absolutely. And it's funny because I did like my first kind of community in-person long COVID talk this past Saturday. And I'll just kind of start there. So May 11th was the end of the COVID pandemic as we know it. And a lot of people had kind of said, oh, COVID is over. And COVID is indeed not over. We know that China right now is having about 45 million cases a week. India right now is experiencing a surge in cases. And COVID, it's still one of the leading causes of death in the US right now. And people don't realize that. It's just not the focus anymore. Because a lot of the funding has been taken away. So there's no need to really have a lot of the forums and to have people just learning about what's going on. So now we are in what the phase that we call long COVID. So while people are still getting COVID infections, there are some people who are dealing with the effects of some of their first COVID infections years ago. And so it has an official name, and that's what long COVID is. Long COVID is actually a disease. About 10% of the population, of the US population infected with COVID now have long COVID, 10%. And so what are some of the symptoms? So there were many, and the CDC and other organizations kind of came together and put together, I think it's maybe 12 on this list. So post-exertional malaise, fatigue, brain fog, dizziness, any type of GI symptoms, heart palpitations, changes in sexual desire or capacity, loss of smell or taste, thirst, chronic cough, chest pain, and any type of abnormal movements. So those are all the symptoms or what we categorize as long COVID. So how many of you, well, first let's start there. For those who are watching in the chat, how many of you, like by show of hand, knew about long COVID? So let's see. Oh, okay. So you're in the right place. That's good. So it's so bad with the symptoms because before, so many Americans were actually going to their doctors, and it's a global thing, but I'll just focus on America because everybody's like, oh, it didn't happen here, it's happening in other places. So everything that I talk about tonight will be based in the U.S. So things have gotten so bad with the neurological condition, the cardiac conditions, and just so many different, like those 12 symptoms are just kind of a summary, but there are so many individual symptoms and broader categories that people are experiencing. And it's so bad now that long COVID now has its own ICD-10 code. And that's the main thing that I want to get out, because once the pandemic ended, funding has been cut. So a lot of people that were on Medicaid, so during the pandemic, if you apply for Medicaid, you got it. They didn't do like the long background, they didn't do anything. And so now that the pandemic has ended and that additional pandemic funding has ended, now you're going to have to requalify for Medicaid. So when we look at even the employment numbers, because long COVID is affecting employment, people can't work because they are still sick with long COVID. Are they testing positive for COVID? No. But are they still having symptoms that they got with their COVID infection? Yes. So while we may hear people saying like, oh, the employment numbers are good, that's because people have stopped looking because they can't work. And that's what's not being said. And so when we get into the mental health aspect of that, so that's why a lot of our mental health numbers are increasing, especially in the Black community, is because they can't work. So when the pandemic started, who was still working? What was the workforce that was carrying the backbone of our country? It was Black people. We were the cashiers. We were like we were doing everything. And now we're the ones that are actually feeling the brunt of long COVID. And I'm suffering.
Good. I'm sorry, Doc. Let me ask you a question, because you mentioned the first symptom, but it was like some medical jargon. Can you?
Post-exertional malaise. So it's like if you do any type of activity and you get tired. When I looked at the data and the reports, and NIH has conducted a study, it hasn't really been the best study, and people who have followed me, they know I tell the truth and I can back up everything that I say. So fact check me if you want. So the NIH actually conducted a study on long COVID, but it didn't go anywhere because the symptoms were all over the place. And what they found was pretty much alarming. People could barely walk 3 or 4 steps without being tired. So people who had jobs that required them to be mobile couldn't work. So now they're out of the workforce. So think
and those numbers look different for us than it does for our Caucasian counterparts, right?
Of when we look at insurance. So the ICD-10 code is U09.9. Most doctors don't even use it. But what they do is diagnose you with respiratory disorders, some neurological. So you have all these independent diagnoses without connecting it back to COVID. And now that the pandemic is over, insurance companies are changing the way they are covering these services. So make sure you have that ICD-10 code U09.9 so that if you get COVID, and which will probably all, well, I still haven't gotten, knock on wood, but most people will probably get it like towards the fall of the year, which increases their chances of getting long COVID as well. So the more time, the more you are infected with COVID, the higher your chances are of getting long COVID. So
you raised something important, number one, because I wonder, do we really know? You know, we often talk about the collateral consequences of COVID, right? So we don't think long COVID, right? Especially for those of us who think that it's not true, right? And there are those of us in the Black community, or, you know, we have this conspiracy theory and all of that. So two things I guess I'd like to raise with you. One is there a prevention and or treatment for long COVID? Does it stay forever, right? So does that mean, you know, I had long COVID, next year, it just worsens, right? Or is there a vaccine on the horizon?
They don't know. Like, everything is still new. Remember, we're just 3 years in. People, they still don't know what are the after effects of the vaccines, of the mRNA vaccines. Like, remember, in 2021, when you got everybody that got that first round of mRNA vaccines, they were enrolled in a 2-year study. So they're tracking your symptoms through whatever your doctor is putting in your medical record.
Wow.
I don't know.
So we don't know. So here's what I guess the other question, the other thought about that is, so how do we arm ourselves? So is it inevitable, right? If you've had COVID that you could possibly have, how do we arm ourselves so that we are better equipped? Because you raised something interesting. You said, you know, we worked during the pandemic. And I often said, you know, we hosted an emergency town hall. And one of the things that I said during the town hall is that we had, you know, my colleague always reminds me, he says that when white America gets a cold, the Black community gets pneumonia, right? So we know that to be so. But I guess what I'm most concerned about is that an automatic, if you've had COVID, that you could possibly have long COVID? And then what kinds of things can we do right now to arm ourselves physically to prevent long COVID, if anything?
If you don't have long COVID right now, the best thing you can do is not get COVID again. So that's physical health, making sure you're exercising, taking your vitamin D3, whatever you're deficient, knowing your numbers, making sure that you don't have any comorbidities that will make you susceptible to COVID down the road, because the strains of COVID, they're over, let's see. So we know Omicron was the one that uncoupled everything. So there are about 600 substrains of Omicron right now. And a variant of Omicron is prevalent now in the US. It's an XBB. It's so many that they stopped going by the Greek letters. So it's XBB.1.5. And that's 64% of the cases right now circulating in the US, which is also similar to the variant that's circulating in China. It's XBB.
Wow, Dr. Ken, I think you have me in shock. My mouth is open, even though you guys can't see it. We have a couple comments in the chat.
Okay.
Pa Williams said, I believe some people are suffering in silence with long COVID because the world has moved on.
Mm-hmm.
Highly praiseworthy 100 said, So how does that affect a child who already has respiratory and lung issues? And I just to piggyback on that, I know a lot of people, like my kid was only 18, I think. I had told Andrea he was having heart palpitations, didn't know why or never had problems before, and the doctor said most likely it was because of COVID. And he was healthy.
And that would be a symptom of long COVID, and make sure that he's being diagnosed properly, because so I tell people this, and this is the best way that I can explain COVID, because we're seeing heart attacks in the 30-year age group, in the 40-year age group. COVID accelerated diseases that people typically wouldn't get until like their 60s. So if you were pre-diabetic, now you're diabetic. And I'm pretty sure we all know someone who was like, got COVID, now have diabetes. If you were predisposed to any type of heart disease, now you have heart disease. And it didn't discriminate. Age wasn't a factor. So now we have those 20, 30 somethings that, and even like shingles. So, we know that the shingles virus lies dormant, and then it's a form of chicken pox. And then as we get older, it used to be when we got older. Now we're seeing it in individuals as young as their early 20s that's brought on by stress, but that's a whole nother topic on shingles. But in some people, what we're seeing is that COVID is also lying dormant. So our body doesn't know how to respond. And that's another reason why we have the long COVID, because we never really got rid of the COVID virus. So.
Wow. And so I'm looking here, and it also says, yes, ma'am, my sister is now under care of a cardiologist. So you already answered this one. How do we prevent our children with compromised immune system?
Yeah, wear masks. Like I wear my mask. I'd be the only person traveling. I'd be on the plane happily with my mask on, because the world is open, and they're not talking about it. What country was it that was giving people free trips? Was that it was somewhere in Asia? One of the Asian, was it Hong Kong? One of the Asian countries, because they were trying to increase tourism.
But I have to ask this. We've heard stories about how even the mask, right, can cause issues long term. And I hope that, I don't know, right? So I like the thought that we get to separate
masks
from truth.
So here's the thing: masks don't cause long-term conditions of anything, because the masks are still breathable, and masks aren't 100%, effective against keeping out any type of virus, unless you're like a painter and you're wearing like, the masks that have like the filters on the side. So just a general mask, it's still breathable. But what people were doing, I found during COVID, was that they were reusing their mask over and over. And that was why some of them got sick, unfortunately.
Yeah, I got it. I understand that. And I know we've heard that. So that's helpful, because what I will say is that the masks have been quite a challenge, right? And because it's not a requirement, we don't wear it like we should. Now, I was away recently. I was in a couple weeks ago, a month or something. Feels like 3 months now. I was in Puerto Rico. And it's so funny. My husband was like, I'm not wearing my mask on the flight. I'm like, I am, because I'm not sitting you and I will sit together. So it's just interesting that dynamic, right? But what should the message be in communities of color? What should it be? Not about the mask. How do we, they made such a big deal about making sure that Black people had the vaccine. They made such a big deal about making sure Black people had a number of these things, but nobody's talking to us about long COVID. And, I think, I appreciate, because you said at the onset, look, I'm a community health advocate, right? Period. I'm a public health advocate. But for those who aren't, what do we do in our spaces to influence a population of people so that we still understand what's at stake? Because based on, as I listen to you, it is still pretty scary
It
about
should
what
be.
could be
The
possible for
CDC,
us.
there was a conference, CDC conference of epidemiologists the end of April, and there was a COVID outbreak. But they're not talking about it. It was 1,700 people in attendance, and 171 people tested positive for COVID. Google it. And
Wow.
everybody didn't report because now you just don't know because of home test. And I think only 85% of the people that attended responded. So the numbers could be higher. That's more than 10% of the attendees that got COVID.
But you said something
No,
interesting about home tests. Should we
you can
not
trust
trust
the home
those?
test, but people aren't reporting. They're testing at home instead of going. So
Got you.
we'll
Okay.
never know the true impact of COVID because people test at home and they choose whether or not they're going to expose other people. So it's literally like you're dependent on the next person to do the right thing. And that has been the problem since the beginning of the pandemic in 2020. People just didn't do the right thing.
Yeah.
So my message to the Black community, don't abandon the practices that we had during COVID. If you wear your mask, please still wash your hands. Please still wipe down these shopping carts. When you get home, the first thing you should do is wash your hands. Use your hand sanitizer.
Yeah.
Simple things that we've abandoned.
That's fair.
Thank you for sharing that because Andrea and I have both seen like people just totally don't wash their hands, don't use hand sanitizer where they were using it religiously before, and I think that's scary.
And to Roxana's credit, one of the things that we noticed that she used to do religiously, we would go into the office maybe once a month, maybe twice, and she would always wipe down the chairs, wipe down the table, because we saw people come in and out and do all kinds of gross things. And so,
especially in restaurants, people didn't realize, even like when we kind of like opened up, the restaurants were the main perpetrators because people were coming in. Most of the people working were sick because they couldn't afford to call out because they needed their jobs. And the restaurants weren't cleaning their filters. I consulted with a church. So during this time, I am a public health consultant. I have my consulting business. Consulted with a church. One of the things I'm like, you have to have your filters clean. Look how many, you have tens of thousands of people coming through here every week. You have to clean your filters. Same way we have to change filters at home. Businesses should be just as vigilant. And they weren't. And that was the main thing that I saw, these dirty filters that were just filled. And, the filters trap everything. So they was just circulating it back into the air. This one church was like, we don't think we've ever changed our filter. They were at their location for almost 20 years because it was a large church. And so at the end of the day, they were like, oh, it's going to cost us like $50,000 to change filters. And I just looked at them in the straight face and was like, it's time.
Yeah, time. I know that's right. She said it's time.
A few comments in the chat, one question, but I'll say the comments first. This is so important for our community to understand, and that's when we were talking about keeping the practices during COVID. And this is why I've missed your lives. So they're saying this is why you need to keep educating and putting out this information. And to come back to our question, monovalent versus bivalent vaccine. Does a bivalent vaccine protect against long COVID?
Okay, so let's dive into that. So monovalent just means one strain. So the initial vaccine, mRNA vaccines that came out were monovalent. So they contained the initial Wuhan strain of COVID. Those are no longer on the market. Last fall, they introduced a bivalent vaccine, which consisted of the Wuhan strain and Omicron strain. So that's the current vaccine that they're giving, which is bivalent. But they're not pushing it because guess what's no longer in circulation? Omicron. So Wuhan is no longer in circulation, and the initial Omicron strain is no longer in circulation. So the current vaccine that's out there offers right now at this moment minimal protection against the strains that are currently circulating in the community. That's why people aren't pushing it. I'm just telling you the truth. So what me and my colleagues have been trying to push is for what we call a multivalent strain, which is what the flu vaccine is. And that would incorporate all of the current circulating strains in the U.S. There are about 3 different strains that are circulating in the U.S. right now, but they're all XBB, like subvariants. So that bivalent with just Omicron and Wuhan is not helpful. Remember when we talked about the spike protein in the vaccines? We don't even need that anymore. And the spike protein was one of the reasons why people were getting sick when they got vaccinated. We don't need the spike protein because the current variants bypass it. It's no longer a protector. So I hope, and Andrea, I talk on levels that people understand. So that's another reason why, like, people are like, I understand what you're saying. I can follow you. Yeah.
No, I do. It is, it's enlightening and disheartening and yeah, all at once, right? And I don't want to go back into a panic, but what I appreciate, I appreciate hearing the truth, right? I appreciate the honesty about what won't protect us, right? I mean, let's just, I don't need to stand in the line just for some BS, right? And I think the other thing is the reminder, and I think I'd like for you to give some consideration, maybe not for this month, but for July's newsletter, for our newsletter, like writing a piece about, not abandoning the practices that we become accustomed to. And if we're going to be honest, those are things that Black people were doing anyway. When my grandmother, back in the day, my grandma was like, don't come in my sofa with those dirty clothes. I'm like, well, where do you want me to come? I'm like, where do you want me to go? No, take those clothes off in the basement, then you come upstairs and wash your hands. You couldn't touch her things. And so I love to figure out, because I think we have, as advocates, right, and activists, we have a responsibility to educate our people. And I don't know. I don't believe that that's what we're doing enough of. And partly because we don't know enough.
No one wants to talk about it. I still educate my community the best, especially the elderly, because they've just kind of been left out in the dark. I get calls all the time, like, what should I do next? Like, should I get this? They're trying to pile on all these vaccines, like now shingles, pneumonia, COVID, this, like, what should I do? And I was like, well, are you sick? Do you tend to get sick every year? Because if, and this is just my personal opinion, if you're not sickly and you're taking care of yourself, you're exercising daily, you don't have like the diabetes or the high blood pressure and all of I call it, like, the Fantastic Four. Not really fantastic, but it's what people, they all, the cholesterol, all of that. Then just try to eat healthy and exercise. Because we've seen some of the impact. And I know in previous lives we talked about how there's a website where you can go and you can see all of the side effects where people are reporting from these vaccines. All of them, not just COVID. And there's still, and some of the work that I also do for emerging viruses. So we know that RSV, which is another respiratory virus, basically ramped up last summer, when you typically see it in the winter in children, and adults had it. They had coughs that they couldn't get rid of for months. It wasn't COVID, and they didn't know. And the doctors, and unfortunately, American doctors, like they don't even have the training to be able to recognize these different viruses and what's going on, or even taking the time. And nothing against medical doctors, but some of them they're swamped with patients, so they're not up to date. So
Yeah,
like right now, how many of you have heard of HMPV? It's human metapneumovirus. Let's see.
What the what? Nope.
It's human metapneumovirus, or HMPV. And we had a spike of cases this spring. Nobody talked about it. So it was just discovered in 2001. It's a fairly new disease. And it probably jumped from birds to humans because we never saw it in humans prior to 2001. We saw a pandemic seasonal peak of it. So that was kind of the thing that was kind of also spiking along with COVID. So it's like, I got this cough and they said, well, it has to be COVID, even though you're testing negative. But there's no vaccine for HMPV or any antiviral drugs. So you can only treat the symptoms. And it's very close cousins to RSV. So
that was one of the questions in the chat. What are the symptoms? And I appreciate your transparency and courage to share this information, because I know we get a lot of nasty grams about whenever we talk about COVID, it's not real, all this nasty grams. So thank you for sharing this information.
Yeah, and we have to know the symptoms: cough, fever, nasal congestion, and shortness of breath. So what does that sound like? Every other respiratory virus out there. But when I tell you it's spreading so fast in the population and doctors aren't talking about it, and I'm an infectious disease epidemiologist by training. It's not just a title that I threw on my name. But these are things. It's the symptoms can be similar to a cold. I hear so many people like, I think I got a cold, but it's not a cold. Like, I don't have this. And they're taking these tests and they're suffering, which is another reason why then they're depressed, because I got this that I can't get rid of. The doctors don't know what it is. So how many of us have friends that have been in that boat? And it's either HMPV or RSV. And the doctors aren't testing for it. As a matter of fact, doctors can't even test for it in their offices. The only way that you would know is if you went to the emergency room, because the emergency room, the ER, basically tests for all these different viruses because they know they're spiking. So it's everything. So again, but it's a virus. There are viruses. Hand washing. Yeah. Making sure, like, I still don't touch doors handles. If I do, I'm washing with soap and water. I'm getting my 20 seconds in. Like, don't abandon that, because that saved a lot of us.
I love that.
We can't abandon what worked for us just because we're tired. Because nobody's going to save us. Like I said during the pandemic, no one's coming to save us. We have to save ourselves, and that's why I'm here.
Well, listen, I will say this. We appreciate that. And we just had a call. We did a live with someone, I guess the one before, and pretty much the same thing. Nobody's coming to save us. These are the things we need to put in place for our community. And so it feels different when you say that like that. And I think, we have a unique opportunity, quite frankly, to really educate our people about what's at stake, right? And again, not to make folk fearful, but to make them aware.
It's about awareness. I'm not trying to evoke any type of fear, but we're not out of the woods. I told people, and like the people who follow me, like they know, you can't create a valid vaccine until you have a stable form of the virus. And COVID is still changing. I worked on Ebola. If you Google my name and Ebola, you'll see a paper I wrote way before the Ebola outbreak, and those were some of the things that I looked at. And because of that, they were able to use my research during the outbreak, and they were able to down the road have an Ebola vaccine that was FDA approved. But it took years, because before they could even start working on a vaccine, Ebola had mutated 92 times.
Wow. Wow. Well, I'll tell you, you have been a wealth of information. I'd love to figure out how we have
Yeah.
you, you know, in a town hall setting, because I think that, and we have to figure out what that looks like, but I think that that is important. And we are expanding our work with one of our partners. We're doing some stuff in Northern Virginia, and things that we would have typically done in barbershops and salons. So we're going to have these community conversations. And I think it would be worth, you know, us getting some information from you, or not even getting information, but you having a conversation with folks, because I think that could be a tremendous asset to us. So, Rox, any additional, before we ask the good doctor to give us some closing thoughts and
No,
maybe
I just
recommendations?
added my 2 cents, which is thank goodness that you were like, I feel like sometimes we forget about how important it is to see someone like us in that space, and seeing this strong Black woman talk about these things that are, I mean, it's a foreign language to me, but you know, it makes me comfortable. Like, oh my gosh, this is someone who is working in the space. I can trust her information because I feel that she cares about me and my kids. And if she's saying I should still be doing this,
Yeah.
you know, I am already someone who likes to clean. Andrea is already someone who's like, okay, I'm going to clean up. I'm going to do. But just for those people who are on the line who are like, oh, I don't know if I still need to do this, and why do I got to wipe down my gym stuff before I touch? This is why you can still get ill, and you can still have effects that are long after you expect it to still be like that. I can only imagine how somebody feels mentally that they can't work, and no one knows why you can't work. No one knows how to get you back into your regular groove. That has to be so much.
And it is. And also by ending the pandemic, we also ended states being mandated to report cases. So now there's no mandate to report COVID cases. So we have no idea where we are in the grand scheme of things. And that's what should scare us, if nothing
Yeah.
else.
Yeah. Yeah. But see, but remember, we don't know that information, right?
Yeah.
We hadn't thought about it. And so that's why what you say and share is so critical. Really would like to figure out, and we will figure out a way to have you come back to talk in a different setting about, so just be on the lookout for yet another invitation. But I think it would be beyond IG, and you and I can talk about that. But really want to thank you for your time and your talent today, but also for your transparency with us about really what's at stake. And so, I mean, not in a way that's like, we're going to go hide for cover, but really in a way like, oh, that I should make sure I am keeping those practices that I did pre-COVID and during COVID. Just, continuing, I'll go back to your language.
Because,
Don't
and
abandon
people
what
are
has
saying,
worked.
and so a lot of the backlash I get, well, if I get COVID, I won't die. Like, I'm this. But you can get long COVID. And guess what? You can get any of those symptoms to the point where you can't work. So that should be enough. It's enough for me to still keep my practices because I don't want long COVID.
Yeah. No, that's real. That
Yeah,
is so real. Well, I tell you, this was helpful. I know that you do some consulting stuff. Can you give us the email where we could, if folk
yeah,
wanted to reach out for their companies, or your IG address, that way
yeah.
folk will be able
So
to follow you as well.
I can be reached. My email address is info@safeconsulting.com, and safe is spelled SAPHE, and info@safeconsulting.com. I can also you can DM me on my Safe Consulting group Instagram page, and then my personal Instagram page is DRKW Step, Dr. KW Step.
Wonderful. Well, we appreciate you, Roxanne. I know you usually close us out. Do I need to do anything else?
It's your
I
review.
think she's
And
saying no.
I just want
I'm
to say,
sorry, I was dropping in the chat Dr. K's info her email, and I couldn't email. I mean, I couldn't type
Okay.
it and respond.
I was going
Go
to say,
ahead, Dr. King.
and also let's love on our Black men, because they have been the most affected during this pandemic. And the VA hospital did a study, and they saw the mental effects of COVID on Black men. And that was how they knew that some of the Black men had COVID, even though they had not yet tested positive. They were having mental episodes, and they're still suffering.
Wow. Okay. All right. Well, I think we will message that, we'll message that in our June newsletter. We'll message that period. But we will be ultra sensitive to that. So thank you for raising it.
Yes.
We love our brothers. We do. We really do.
Yes.
Well, I thank you, my dear. It's been exciting, and you worked it out with the glasses and the back there, so it's all good. We thank you, but be on the lookout. We'll
Thank you
reach
for
out
having me.
soon.
Thank you for joining us.
Thank you. All right.
Thanks. Bye.
Yes, thank you.
So we will be going live again in about 5 minutes. We'll have Jeree Cotman on with us. We're going to talk about keeping our mental health important. We are at the end of our mental health awareness marathon.
And we need some mental health.
So thank you guys for joining me. I'm going to stop this live and just restart, so that way I can keep them separate, and we're going to have them as resources on our YouTube page, but it'll have a link from our Instagram to be able to connect with. Don't forget to support Black Mental Health Alliance to keep doing things like this live, and support our speakers that are doing this community work and really putting their, leading by example. That was one of our speakers, leading by example of how they want us to live and be healthy.
Yep.
So we appreciate you.
All right. Thanks. Bye.
Thank you.